Anatomy and physiology of the ocular motility system. Extraocular muscles. A set of 6 extraocular muscles, 4 recti and 2 obliques, control the movements of each eye. Rectus muscles are superior, SR, inferior, IR, medial, MR, and lateral, LR. The oblique muscles include superior, SO, and inferior, TEN. Origin and insertion. The rectus muscles from a common tendinous ring, the annulus of Zinn, which is attached at the apex of the optic foramina and medial part of the superior orbital fissure. Medial rectus arises from the medial part of the ring, superior rectus from the superior part and the adjoining dura covering the optic nerve, inferior rectus from the inferior part and lateral rectus from the lateral part by 2 heads which join in a V form. All the 4 recti run forward around the eyeball and are inserted into the sclera by flat tendons, about 10 mm broad, at different distances from the limbus under. The superior oblique muscle arises from the bone above and medial to the optic foramina. It runs forward and turns around a pulley, the trochlea present in the anterior part of the superomedial angle of the orbit, and is inserted in the upper and outer part of the sclera behind the equator. The inferior oblique muscle arises by a rounded tendon from the orbital plate of maxilla just lateral to the orifice of the nasolacrimal duct. It passes laterally and backward to be inserted into the lower and outer part of the sclera behind the equator. Nerve supply. The extraocular muscles are supplied by 3rd, 4th and 6th cranial nerves. The 3rd cranial nerve, oculomotor, supplies the superior, medial and inferior recti and inferior oblique muscles. The 4th cranial nerve, trochlear, supplies the superior oblique, and the 6th nerve, abducent, supplies the lateral rectus muscle. Actions. The extraocular muscles rotate the eyeball around vertical, horizontal and antero-posterior axes. Medial and lateral rectus muscles are almost parallel to the optical axis of the eyeball, so they have got only the main action. While superior and inferior rectus muscles make an angle of 230 and reflected tendons of the superior and inferior oblique muscles of 510 with the optical axis in the primary position, so they have subsidiary actions in addition to the main action. Actions of each muscle are shown in
lateral rectus, superior oblique, levator palpebris superioris, superior rectus, sphenoid bone, inferior rectus, medial rectus. This is the lateral view of the right eye. This is ocular motility system.